Healthcare in prison was a mixed bag, and it really came down to who was treating us and how they were treating us. Because we had all the same problems as the American healthcare system in general. Issues with insurance, issues with limitation, issues with conflict, whatever. But for the most part, when I went to go see the doctor, I had to fill out a form, drop it in the medical box, and then a day or 2 or 3 days later, they would call me over there and I would meet with a nurse. Some of these nurses were genuine. They would say, hey, tell me what's going on, let me hear about it, and they would ask questions and they would do follow-ups. Others were clearly just processing paperwork. They were just like, okay, next. And they didn't really care. And in many cases, that didn't matter. Like if somebody was just going over there because they were sick or, they needed glasses, that was fine. But there was a guy who had the lump in his neck for months before they finally said like, hey, this could be an issue. And he had gone all the way to seeing the doctor who was on staff. And even that guy was like, oh, I don't think it's an issue. I just think it's your glands or you'll be fine or whatever. So finally, actually, that doctor was not there and they had a different doctor in a place. Basically, somebody was only going to be there for a day or two. He happened to go over on that day and that doctor was like, oh my God, we need to get this tested immediately. Sure enough, he had stage 4 cancer. So it really came down to the attitude and the attention of the staff. So if you had good nursing staff or good doctors or good nurse practitioners who gave a crap and treated people as human beings and asked questions and followed up, yeah, it was much better medical care. What that also came down to is whether they were getting the support they needed. Because sometimes it's a thankless job. Sometimes they're not paid very well. Sometimes they have to deal with harassment from the staff or from the people who are incarcerated. So it really comes down to whether there's a positive atmosphere for the staff and whether they can then show up for the people who are there.